Welcome, everyone. Welcome to the Future Clinician Pathway. Barry and I are very excited to share our vision of how we can help build the skills, the systems, and the confidence in every modern new grad that is preparing for the MSK world, that chaotic, crazy world that we live in the MSK physio space. So come along to the journey with us. Our goal tonight is to show you a future worth building, not necessarily to show you a program. First of all, just thank you to Barry for joining me. A quick introduction for those of you who don't know me. My name's Ben Onofrio. I'm an APA titled Sports and Exercise and MSK Physio. I did my postgrad training at the University of South Australia. I'm also fortunate enough to be in the university space as a clinical educator in undergrad and postgraduate programs. I work in top-level sport with the Australian Baseball League with the Adelaide Giants. So I'm still in the trenches with everyone, still being an educator. And I've got a very strong passion for the shoulder and MSK, but also I love integrating AI, hence the journey with Barry. So Barry, please introduce yourself, mate, and we'll get rolling.
Yeah, thanks, Ben. So I've been a physio for 20 years, practice owner. I've got a clinic in St Kilda. That's sports and MSK. So we deal with a lot of new grads every day. More recently, after COVID, during the extended lockdown in Melbourne, I became a software engineer for 3 years for a large ASX-listed software company. And as a result of that, I created my own software to help solve problems in allied health associated with AI. I'm also a community member at the APA Advisory Group, which is the inaugural one. I also an advisor, a federal advisor for the Australian Digital Health Agency related to the My Health Record and various other things. So my company, which many of you might have heard of, is called CliniScribe. Uh, I'd say we're the fastest growing AI scribe in allied health in Australia at the moment. Thanks, Ben.
So
Yeah.
Barry, let's
Yeah.
continue, sorry.
Yes. So what I'm seeing across clinics, from the data, um, across over 500 practitioners we have on our system, and it's constantly growing. There's inconsistent assessment frameworks and procedures. Decision making is all over the place. There's a lot of disorder there. So there's no consistency between one practice or the other. Um, there's communication breakdown a lot of time between the practice owner, the manager, or the senior mentor and the new grad. There's no systematized way of onboarding anyone, even though we often all treat similar MSK problems in community practice. And admin burnout is a real issue. So even today, there's clinics that allocate time for writing notes, which I think is probably not required now with the AI scribe. And often physios would bite into their lunch breaks and morning teas and after work just to write their notes and GP letters, which is a common trend I'm still seeing in private practice. So yeah, there's a lot of things that aren't done very well, unfortunately, as physios. Not our fault specifically, but there's no consistent framework about clinical reasoning, how we write notes, how we write reports, which essentially makes a bespoke solution or customized template for everyone that joins CliniScribe, for example. Thanks, Ben.
I think just building on that, Barry, too, yeah, like we've sort of put that keynote down, and it does take a bit more time than we think for those new grads to reach their sort of clinical and even admin independence. So that was sort of our vision of discussing our sort of pathway to help create those systems and frameworks to help speed that up. So from my perspective, I have a lot of access to, the recent new grads, third, fourth year students. And the common things that we're seeing here is obviously, yeah, they're feeling like they're not the imposter syndrome. They don't know what they're talking about. They don't know what they're doing. They're fearful of actually loading up patients. They're scared to push them and progress them appropriately. One, because they haven't been taught a system and a framework to do that. And they've had even a potentially poor experience in the past with their placements. So that sort of leads into the rebooking anxiety. I'm not sure how to, sell this. I'm not sure how to actually be confident and be honest with my patient. And as we were saying, and then there's the documentation overload, learning to write notes, how to interpret it, how to clinically reason along with your notes to actually get the right outcome and get a better, clearer sort of roadmap of how we're going to get them better. So, we've built this pathway to help them not just hope they have to wait and see more patients, or have to be given more information, but about giving them that identity and that system to follow to build that framework. So that's where we're coming from, and that's what I'm seeing, and that's what I'm trying to help speed up that process. Over to you, Barry.
Yeah, so onboarding it just takes way too long. Um, in the first year, clinics often make a loss from hiring a new grad to give them that stability of a salary, let alone onboarding technology like an AI scribe. That's another discussion. There is definitely inconsistent performance between one new grad versus another, depending on how they're trained or what they're exposed to, as well as their personality and other traits. But I feel that this can be solved with AI. Um, Invisible thinking. So yeah, we actually don't know. We're more reactive as mentors or managers. We only see the after effects of a clinical caseload or consult. Often we're listening through curtain rooms, walls, trying to mentor them, but I don't think that's the best practice. I think, in my personal opinion, the raw transcript or what is actually said during the consult, all the non-verbals and verbals matters most when it comes to mentoring, not their notes as a result of that. And yeah, there's no scalable way of giving new grads that undivided attention in private practice due to a lack of resources. And physio practice owners need to, have practices of at least 3 to 5 full time to even make it sustainable. So you can see there's this grappling challenge around mentoring, managing your staff, and giving them the value they need to progress to mastery as a private practitioner. These are all contributing factors, including admin, as we talked about earlier, that contribute to this long or onboarding process, which actually bites into your profits. Thanks, Ben.
I definitely think, just to add to that, Barry, we've got a profession that's full of world-class knowledge, but as we said, we sort of don't have that scalable system to, just imagine if we had a shared system of structuring our subjectives, our clinical pattern recognition, making decisions when we're uncertain, and that's going to turn those eager clinicians into good clinicians, into great clinicians, and hopefully leaders to kind of keep building in our profession and help us have a scalable, teachable, visible roadmap for the future coming through. So that was one other little part of our motivating piece. So as we said, that shared framework is pretty important so we can have somewhat of a consistent clinical reasoning system within your own clinic, but as well as within our profession. So that then allows us to have that predictable pathway instead of having to sit in, babysit, monitor, closely supervise, micromanage those new grads, so we can help them understand where they're trying to go from a framework rather than just giving them more and more and more information, or go do more PD, go learn more information. So we are trying to build that scaffolding to help their clinical reasoning and how to integrate AI safely to make them a modern new graduate or even a modern clinician, not the other way around, trying to have to figure out all themselves and provide that structure for them. So I think that's the exciting part from what we're building and what we've built so far. Just to kind of add to that again, Barry, over to you, mate. Let's talk about AI.
Yeah. So, I mean, there's a lot of fear around AI in general, not just physios, that it is here to replace us. I'd argue that that's probably not true, but it will replace certain tasks physios commonly do in today's practice. We're already seeing that in NHS with the AI-powered clinics, where there's no human in the loop at the low level to solve some of these MSK issues. It's important to understand that as physios, we need to leverage and double down on what we're good at as humans as part of being a physio. And I strongly feel, and I'm sure Ben does too, that this is around our manual skills and our clinical reasoning, in that there are ethical decisions we need to help our clients make, as well as help guide them through the critical thinking processes around making decisions around treatment options and potential diagnosis and prognosis. So it's important that we embrace AI to get rid of all the things that we're not so good at and accept that we'll never be as good as AI in looking at a spreadsheet, even doing physics anymore, and analyzing biomechanical patterns as well. um, as retrieving knowledge and synthesizing knowledge. So we need to focus on what matters to our client patient-centered care. We've all heard about it. And that is around leveraging our human strengths to help them make decisions, to provide better care, to provide that hands-on rapport building from an assessment and treatment point of view, and assist them in their journey that way. And I feel that's where we fit in as MSK sports physios. I can't comment on other areas of physio. Thanks, Ben.
I definitely think, Barry, just to build on that once again, if we can let AI do the grunt work so we can focus on our patient in front of us, the therapeutic alliance, our soft skills, our manual skills, that goes a long way, especially for the new grad when they've got all these different things running through their head in their first 6 to 12 months of practice. So once again, talking about the grunt work, imagine if you're a new grad or you've got a new grad working for you that has a live, reasoning compass that can be a bit of a co-pilot with their AI program while it's taking their notes. You can refer back to their case notes, offer some suggestions, assist their clinical reasoning process, not replace it, but give them some ideas about things that they might not want to miss, maybe potential red flags, differential diagnoses, picking up certain clinical patterns. Because if we don't know what we're treating, we don't know how to assess it. We can treat impairments, that's great, but if we're not treating the source of their problem and their actual driver of their problems, whether it's a biomedical issue, which is kind of a bit old school. We're looking at that biopsychosocial approach. So how do we identify these things, or how do we recognise if we've missed them in our subjective as well on day one? Those first, 1 to 3 consults are pivotal to help build our clinical reason, build our clinical pattern recognition, and then figuring out which tests are important to help us rule in and rule out things. And there are lots of tests that can be good, and there's lots of tests that don't really give us much. So that's what we are synthesizing within our framework and our model based on reading all the research and analyzing that to help save you guys the time to have it all in there, which will then lead to those last 2 kind of points about how do we improve our soft skills and our communication with those tricky patients, the chronic pain patients. How do we rebook? How do we progress appropriately? How do we have those difficult conversations in a simple way? Or how do we word these in a friendlier way? How do we make it less threatening? So that's where I think AI can help us if we get to the right path and the right diagnosis. Based on the evidence and experience, we can help improve those things. And then, like we were saying, from a dashboard perspective, there's the clinician dashboard where we can help them with those clinical skills. And then as a business owner, we've got some clinical dashboards where we can work out what your clinic's seeing, how they're handling it, what we're doing well, not micromanaging, not to scrutinise your new grads, but more just to give you an idea of what's actually happening within your clinic. And you might be able to find areas where you can do more PD if it's you running it, or if you need to get someone in. So lots of little things that we have thought about of how can we accelerate that clinical growth as well as the individual's growth within this framework. So it's a very exciting thing that we've got going in the dashboards we're building. So without giving away too many secrets, I'll leave that one there. Barry, what's the data telling you, my friend?
Okay, so what I'm seeing at CliniScribe, physio specifically, is the note quality is very variable, and sadly, they're all starting to look the same. So what I mean by that is, uh, physios are using popular AI scribes, and they're using the same templates, and the AI is filling in certain details that the clinician may or may not have included, um, which is kind of concerning. So we're seeing kind of cloned notes consistently between one physio and another, which is not reflective of a human being or their reflective nature or clinical reasoning skills at all. Therefore, that does not provide visibility over or even protect the practitioner over what they've done, because everything, as I said, looks very similar. Common blind spots. So red flags is a very common issue, as well as all these other factors where the AI is potentially identifying things while the physio sees it and approves it as an autopilot after the fact. And as I said earlier, generic treatment plans, generic notes, generic patterns of soap notes coming out consistently. Um, it's an increasingly concerning issue in that we're actually putting a lot of garbage in our databases um, of AI generated content. And I'm very concerned around that area. And I hope to fix that with great training programs and building CliniScribe in a way that safeguards our profession and uplifts it moving forward so that we have compliant, ethical notes while producing great physios for the future. Thanks, Ben.
So building onto that, so obviously what Barry and I have created so far. The pathway for this, we'll call it the MSK Future Clinician Pathway. It's a 12-week program. We're going to have some online modules weekly that will consist of some clinical specific information, marrying that up with how we can integrate AI and how we can also then improve their soft skills. So we kind of have an hour of structured learning, plus we'll also have an hour of coaching calls where we can actually integrate all this live, run through some prac stuff, run through some demos with Barry and I. So that's the initial vision we have. But then the key part of it is being co-designed. So we are building what we think is great, but we actually really want to have what the clinicians and the business owners want. So there's going to be a very big push for later on in the next few slides when we talk about the expression of interest. If you're interested in getting a new grad, or if you're a new grad wanting to sign up, that we want both parties, the clinician and the boss or the clinic owner, to be involved, so we can learn what everyone wants and we can build something for you guys. So that's going to help us build that comprehensive approach from a clinical perspective, a business perspective, and how we can also integrate AI from a clinical perspective as well as the admin side of things to help speed up both ends of the business too. So this is more than just a CPD button clicking, sit down, don't think. It's going to be very interactive, improve your soft skills, learn from our mistakes, learn from what Barry and I have had over the last 15, 20 years. So I think that's, these are some of the things that I wish I had when I started my career. But yeah, that's the vision. So as I said, we want to build this with you, for you, and for future generations. I want this to outlive us and help change the way our profession is going to be perceived. Make sure we still are number one in that allied health space for MSK sports-related conditions. So that's the big driver for me. So hence why we're talking about we're not building this alone. We want to do it together. And obviously, we're going to be doing a pilot to help get the ball rolling. We've got our content ready. We've got our AI stuff ready to go, which is, like I said, I'm super excited. We're keen to see who else wants to join this journey with us and actually build a future worth being a part of. So it's not just going to be another generic AI training program, a weekend course. It's going to be stuff you're actually going to take in each week, each day into your clinical practice, and we're going to help you build it. So there's at least 25 plus hours in this sort of 12-week program of PD that they're going to utilize, but it's going to be digestible, accessible, and easily applicable in the clinical space. So as we said, typically clinic owners, new grads, I don't want to double up, but this is just a quick little way that who we're designing it for. And as we said, a quick little summary of how we're going to go about it, what we're going to do. Back to you, Barry.
Yeah. So we've got a framework we're basing the course on, as well as the product we're developing for CliniScribe in time. So clinical mastery, what Ben and I strongly believe is around problem solving, clinical reasoning, and pattern recognition, rather than being more knowledge retrieval based. So you will learn that through the modules for different conditions and body parts. So we've covered basically the most common and most popular things we see in private practice in the MSK sports setting. But bolstering that, we're using AI tools like ChatGPT, CliniScribe, to allow new grads and other participants to learn at a higher level, using that as a brainstorming tool to enhance their thinking, learning, and reflective processes, and also saving time ultimately and improving patient care. And communication mastery is a very big part, as anyone who's successful in private practice should understand, that we also have to be able to sell ourselves very well. I mean, people don't like that word. It's often dirty to say, but it's absolutely critical that it's a pillar of what clinical excellence looks like in private practice. Thanks, Ben.
So like we were saying, the plan will be by the end of week 12, your new grad will have built their repeatable clinical reasoning framework for their MSK conditions they see. They'll have better, clearer subjective, objective structure, one from an AI perspective, but two from a clinical perspective. So they're understanding what they need to do, what it tells them, and how we can also structure that to help them interpret it quicker and safer, to help with managing uncertainty. So that's going to improve their confidence, whether it's with different clinical patterns, progressing load, progressing rehab programs, managing that return to sport, return to work population, which is another challenging thing completely in itself without having any strong clinical skills or soft skills. So how to communicate with GPs, like we were just saying with Barry, and how AI can assist that workflow within the CliniScribe platform because it's very allied health specific. The beautiful part about it is that I'm going to go on a quick little tangent here, Barry, but talking about how you've been successful with building that product by integrating feedback, integrating it quickly, listening to your customers, just like we're going to do with this program to kind of build that and build what people want so they can then have better outcomes for their patients, better experiences as a physio, and have a successful clinical practice and stay in the profession longer than the average of 7 years. So it's we're trying to build something bigger than just a 12-week program, but trying to give you lifelong skills that you'll learn a lot quicker by doing this rather than trying to figure it out yourself. So the pilot will, as we said, will have very strictly limited numbers. The aim is to have about 10 in the pilot program. Obviously, our content will be pretty well protected because we're going to be starting to build this. We're going to learn from it, learn together to build this as a collaborative approach. I really want to make sure that the clinician and the employer are involved in this program together. The employers don't have to do too much except sort of monitor their new grads' growth, but also have a little bit of input with us from a reflective perspective while we give there's a lot of learnings, reflection for the new grad who's doing the program. But we want those clinicians that want to be actively engaged and see their start to mid to end, progress throughout this journey. So there's lots of clinical gold, AI, AI gold, as well as learning how to speak better and deal with those soft skills. So Barry, over to you.
Yeah, so the bigger vision here is to ultimately create a better future profession for physio, equip new grads in a sector that's often underprepared in the undergraduate, postgraduate courses, and have very clear systems around how private practice should work in terms of best practice, evidence-based practice, and making sure the commercial outcomes actually prove the systems work. And these AI systems are built with a human in the loop, and taking a very data-driven approach, meaning decisions at the clinic should be based on data, not based on listening over a curtain. Thanks, Ben.
So we're getting to the pointy end of the webinar. So as we said, we're going to be taking expression of interest. I'm going to provide you guys the slides, the video replay to watch if you want to watch it again, or if you're watching via the replay, obviously, so you can get access to it, as well as a link to join the expression of interest. It's not a commitment yet. We just want to work out if Barry and I are a good fit for your new grad or new grads and your clinicians. So we just want to get to learn a little bit about you guys, make sure that we're all looking to get the right things out of it, and making sure we're a good fit for the program. So just before I get to the question and answers, I know you might have to shoot off soon, Barry, but thank you for your time. I appreciate you being on this journey with me and helping me, guide us through this process and, helping shape this future of physio. So we look forward to working with you guys in the future. But if you have to rush off, Barry, I'll take the questions if there's any.
Yep, thanks, Ben. Anything, just forward me the questions, or you can email me as well, and Ben will provide you with the details after the webinar. Have a good night, everyone.
Thanks, Barry.
No worries.
So to the few that are on here at the moment that are still here, any questions you want to chat in the chat box or ask away, guys? Let me know. Otherwise, let's wrap it up. Once again, I'll be sending everyone the replay and the notes. And yeah, I'd love to see the expression of interest. We've had a nice turnout of 60 plus who registered for this. So a lot of you will be watching the replay, and I look forward to hearing from you. Have a good night, guys. Take care.